Welcome to the Regen Doc Podcast, powered by dynamicathlete.com. I'm your host, Dr. Aneesh Garg. I'm Yale trained, Andrews trained, and a two-sport U.S. national team doctor here to help you make sense of regenerative medicine. Stop getting steroid injections, period. I'm going to say something most doctors won't. Steroid injections are substandard medicine the overwhelming majority of the time. It's not just ineffective, it's harmful. They destroy cartilage, they weaken tendons, and they accelerate the disease you're trying to treat. And the only reason you keep getting them is because insurance pays for them and your doctor doesn't offer anything else. That stops today. Let's get into it.
My doctor gives me a cortisone shot every few months. It helps for a while. What's the problem?
Well, the problem is the steroid injection gets you nowhere where you want to be and actually inhibits your healing. What do I mean by that? If you look at what the steroid injection is, it's a potent anti-inflammatory. You are trying to mask symptoms. So you may temporarily feel better and then all of a sudden it comes back, right? There's a Journal of American Medicine, the American Medical Association, JAMA, where it shows that corticosteroid injections, cortisone injections, however you want to refer to them, when you inject them into a knee, you actually lose more cartilage than if you just put salt water in, saline. The system is broken where that's what people can offer if it's covered by insurance. And people are looking to get things that are covered by insurance. So I'll go to PT, I'll go get a steroid injection, or in the reverse, I'll get a steroid injection, go to PT. If that doesn't work, well, surgery is my next option. And now, especially nowadays, when people have a high deductible, it's not that your out-of-pocket expense is going to be nothing. So it's something to consider in terms of that. So your doctor offers it because insurance covers it. You leave because you may get a couple of weeks of relief, and then the cycle repeats. That's a business model, not a treatment plan. So every injection of steroid that you get weakens the tissue further. Thinner cartilage, weaker tendons, less tissue to work with until you finally seek something that can help you. And I think that's where the gap is here. The knowledge gap here is that there are options that can be done besides steroid injections that people just don't know about.
But cortisone reduces inflammation, and that's what's causing my pain. How is that bad?
Inflammation actually isn't bad. Here's another take that I'm actually in the pro-inflammatory camp. And what do I mean by that? When you get injured or you have chronic arthritis or you're having a partial rotator cuff tear that's causing you pain, you may get some inflammation in there, and it's really just sort of stagnant inflammation, meaning that it's old inflammation that's just trying to help in whatever way it can. I'm in favor of a pro-inflammatory response. So I want good inflammation in there. I want good blood flow in there. I want to hyperconcentrate your healing factors into this area so that way you can help heal. And so the challenge becomes is it's so ingrained in everybody's mind where the old rice method, right? Rest, ice, compress, elevate. I'll take a couple of ibuprofen and I'll figure out what to do from there. What if I told you all of that is actually hindering your progress? And your steroid injection is just amplifying that problem. And so when you look at a pro-inflammatory response like PRP or stem cells or Shockwave, focused Shockwave, this is working with your inflammatory process in your system, and you're delivering what your body would typically do to heal a problem, just at a hyper concentrated level. So it's almost like you're overriding the system when you're doing this. We don't talk a lot about trials, but I'll give you just a number where 56 of these trials with steroid injections versus PRP. And not all PRP is the same. So there's a dedicated episode that if you are going out there and looking at PRP as the same as I'm going to go to the grocery store and I'm going to go get some bananas, some bread, PRP, a gallon of milk, and some candy. You are making it seem like all PRP is the same and you're just looking for price. So in these studies, when you look at a lot of these studies from a steroid standpoint, PRP outperforms steroid injections every time, past 4 weeks. So the evidence isn't even close. So anybody that tells you that there's not really good evidence with PRP is being lazy, and you should walk out. Go get a second opinion, because I think there's enough out there. Look, there's randomized control trials and there's real world data. There's a shift towards real world data just because randomized control trials take forever. They take a lot of money. And then by the time we're going through this, we've already advanced onto something else, especially in regenerative medicine. So that's one of the things where people are stuck. Not only patients, but physicians. They're not up to date on these things. And so if somebody tells you there's not enough good evidence, and that's why they're giving you steroid injections, walk out. It's really important to have an understanding of the damage that steroid injections are doing to your body. And I know some of you are sitting at home or driving in the car and thinking, what am I hearing? All my life, this is what it's been. I'm hurt. I'll put a little steroid in it. I'll feel better and I'll get on my way. All the while, you're doing more damage to what's going on. And I think that's the challenge. You look at focused Shockwave instead of a steroid injection, right? One is pro-inflammatory. Focused Shockwave is actually bringing healthy cells into that area. It's increasing blood flow. The absolute opposite of a steroid injection. And so if you want to have surgery faster, then get a steroid injection by all means. If surgery is your goal, then get a steroid injection and fast track that. But if you don't, and you see surgery as your last resort, then I would tell you to stop getting steroid injections, period. And I think that's probably pretty hard for people to hear, but there's a reason why. And if you look at people even searching for terms like, are steroid injections bad? Does cortisone destroy cartilage? Is cortisone short-term damage? You'll pull up a whole bunch of research that'll show that PRP beats steroid injections past the 4-week mark every time. So I think that's really been the biggest thing. And so the biggest culprits here are knee arthritis, people just doing a steroid injection, medial or lateral epicondylitis, so golfer's elbow or tennis elbow, respectively. And even that's a misnomer, where this lateral epicondylitis for tennis elbow or pickleball elbow is actually not an inflammation, right? The itis, you think of inflammation, it's actually tissue degradation. So when we call it lateral epicondylitis, it's actually an incorrect term. Same thing with medial epicondylitis or golfer's elbow. So that's why a steroid injection in these places is substandard. If that's your only option that is given, walk out. Go get another opinion, because that's substandard care. And same thing from an Achilles standpoint. That's where if people are still injecting Achilles with steroid, don't even take off your shoe or sock. Just walk out right away if that's what you hear, because that is going to weaken that tendon and put you at a higher chance of a rupture. So that's my biggest concern with when I see people for second, third, fourth opinions and they say, oh, I've had this many steroid shots or this or whatever, and they haven't got any better, and that's why they're coming to see us. The other thing to think about, that if you think, well, I'm going to get a steroid injection and then maybe I'll go get some of these other treatments. If you get an injection in your joint with steroid, typically you're waiting 6 weeks before you do anything else, because again, it's a really big anti-inflammatory. So imagine you have to let that get out of your body and out of that joint for us to be able to now go do the polar opposite of it, which is a pro-inflammatory component. So you may be stuck at week 2, 3, 4, 5, 6, and you can't do anything because now you've entered into that vicious cycle where it's not helping you a whole lot. So that's, to me, what actually matters in this situation. If any of this stuff resonates with you, I encourage you to go to dynamicathlete.com, read about all the things that are alternatives to steroid injections, and really get yourself informed.
So if cortisone is harmful, what should I be getting instead?
Well, we touched on this where PRP is certainly helpful. So if you look at the modalities or mechanisms or biotech, there's a lot of different options. So one of the things that we use is extracorporeal magnetotransduction therapy. It's a mouthful, I know. It's EMTT for short. It's a big old magnet that actually gets your cells into the right position from a polarity standpoint. So imagine pluses on one side, minuses on the other. And that means your nutrients can go in and your toxins can go out. Really good healing environment. So that's what can be helpful in one respect. Focused shockwave, we talked about, where it's sound waves that target these damaged tissues. So you won't feel anything if something's normal. And then all of a sudden you're like, yep, that's where I hurt when I hurt. And so that's a really good option. PRP, stem cells, that's also a really good option. Radial pressure waves can help, but typically that's more superficial. And if anybody's telling you that they're using radial shockwave, that's also a misnomer. Don't let anybody fool you. Radial is not true shockwave. Just like unfocused waves is not true focused shockwave. So those are the things that I sort of look at where that can help you in that regard. But that's what people should be looking for if they want to go the pro-inflammatory route.
What do you see when someone comes in after years of steroid injections?
Tangible damage. I mean, you can see tendons that have been weakened. If you're getting MRIs and you're starting to look at these things where the cartilage loss, or they've aged tremendously from where they should be because of repeat steroid injections. I mean, look, even one steroid injection can cause you damage. So for those that are out there that are like, oh, I'll just do one and we'll see how it goes. Again, I think that's substandard. I think there's enough evidence out there that you shouldn't be doing steroid injections, period. And then you start to alter the tissue. And then a treatment that was supposed to help is actually causing damage. It's heartbreaking. I give you countless examples of people that'll come in and say, yep, I got a steroid injection and it helped maybe for a couple of days and then I'm back to where I'm at. So now I'm just popping anti-inflammatories or pain medication, right? Think about that. The effect of steroids when they wear off because they weren't the right choice in the first place. And now you have to go rely on pain medications, which some of them can irritate your stomach. And then heaven forbid you end up in the ER because you have a bleed because you've been chomping on anti-inflammatories because you're in pain. So that's the butterfly effect of a steroid injection. And I think that's the challenge that I sort of see. You're not really managing the pain here. You're masking symptoms. Imagine there's a fire going and the pain is this smoke detector that keeps being really annoying. And you just take the batteries out and you silence that, but the fire is still raging. Versus trying to tackle the fire so then the smoke alarm stops going off. Those are the two options that you're dealing with. Steroids are like taking the battery out, and all the other stuff that we're talking about is actually addressing the fire. So that's what I would tell you from a patient side, from a patient experience standpoint, that you're just managing the symptoms and masking the symptoms and not actually taking care of the problem. And then you just speed up your clock towards what? Surgery. And so that's the challenge here.
So what should I do the next time my doctor reaches for the cortisone needle?
Walk out. No, I mean, seriously, I would say no. I would ask, what are my other options besides this? And if they can't tell you and they can't describe it or don't know, I would tell you to walk out. Look, we see tons of second opinions all day, every day. And so I think if somebody gets their feelings hurt about you going to get a second opinion, you probably shouldn't be seeing them anyways, because now they've made it about themselves and not you. When people come and see us and say, I'm going to go get a second opinion, I say, great. Maybe they see something that I don't see, and then let's figure out how to get you back. And so I think at the end of the day, that's the biggest thing. So if they can't answer what the steroid's doing for your long-term health and truthfully say, hey, this is not that great for your long-term health, that's your signal. Pack your stuff up and walk out of the office. If you've had multiples of these, stop right now. If you have a steroid injection tomorrow and you hear this, call the office and cancel your appointment. The steroid injection will be there if you want it. If you really, really want it, it'll always be there for you. But go get another opinion. Go find out what your options are. And understand that this cortisone shot isn't a care plan, a treatment plan. It's this hamster wheel that you're on until you get surgery. And you're essentially just fast forwarding your clock. So the thing that you think is helping you is actually speeding up the downside. So I would get evaluated from a different vantage point and see what your options are. If it doesn't work for you, great. That's okay too. But you should be knowledgeable about what's going on. So really a big takeaways here, steroid injections, hopefully I've demonstrated that it's substandard care, and there's plenty of evidence to prove that. PRP outcomes and even other options outperform steroid injections, and it's not even close. And the fact that you see that if you're getting these injections, you're just now on this never-ending loop until you get surgery. So go to dynamicathlete.com, read up on these things, find out what is going to be possible to help treat, manage your condition. And the best part is, from a biologic standpoint, from in your body standpoint, there is no downside to what we're doing at Dynamic Athlete when you're talking about focused Shockwave and EMTT, and you're talking about PRP and stem cells. And when I talk about stem cells, make sure they're coming from your body and not from an outside source. But we'll get into a lot of these. But the big thing here is the steroid injections. If I can stop one person from getting a steroid injection, totally worth it, because I don't want you to go down that path where you didn't know and you blindly got a steroid injection that's actually damaging your issues, rather than looking for solutions to your problem that are more meaningful. We'll see you next time.